Hello, Dr. Keith Smith with you, Surgery Center of Oklahoma. Today I'd like to talk about cherry picking. My wife made a great point the other day when talking about this phrase that is leveled at us by typically hospital systems, that after the hospitals sweep up all of the business that they want from the big insurance carriers, many times with contracts that specifically exclude facilities like mine, and after they lobby successfully for a very lucrative reimbursement from Medicare and Medicaid, Medicare, in fact, multiples of what I have listed online, after they sweep up all of this business and lobby for all this great reimbursement, then there's this little tiny sliver left of patients for facilities like mine to take care of. Not much access for the folks outside of what they've already swept off the table. And then they claim that we're cherry picking off of this very, very tiny slice. It's a very insightful point, and something that I'd like to point out when you hear someone say that these cherry picking surgery centers and they're just operating on the healthiest patients and the ones who are best able to pay. Well, that's after the big hospital systems have swept almost all of the business off the table to themselves. A very, very insightful way to look at cherry picking. The other way to look at cherry picking and to deal with this term is to understand that every patient that walks at a hospital is a cherry if you want to look at the source of getting paid. If you remember the uncompensated care scam and how that works, the hospitals are actually reimbursed to the extent that they claim they lost money many times. So this uncompensated care scam renders any patient that walks, say, into their emergency room as a cherry. The other point I want to make about cherry picking, and I think proof that this is an invention of someone in a big hospital system, is that it's a completely upside down way to look at markets. The idea that a facility administrator or a physician like me has reached out and picked cherries, patients, that's really upside down. It's typically the buyer that picks the seller. What I would maintain is that the Surgery Center of Oklahoma and other facilities like mine, we're the cherries, and we're being picked. We're being picked by the buyers because we have decided that we are going to enter the market economy. We are going to declare boldly and proudly, here is what we do, here's how much we charge, and then be judged by the market on whether or not that's valid and whether we represent a true value. So I say we're the cherries. Increasingly more and more of the buyers are picking us. And so I'd like to flip this whole cherry picking thing upside down and have you consider looking at it in a little bit different way. Thanks for joining us. We'll see you next time.